Imagine a silent enemy creeping up on men globally, taking lives every 41 minutes. This foe is prostate cancer, the most common cancer in men. It's like a stealthy adversary lurking in the shadows, quietly causing havoc. But, like all enemies revealed, its power diminishes when we shine a light on it. In our world today, prostate cancer is not just a health issue, it's a global crisis. 1 in every 8 men will be diagnosed with prostate cancer in their lifetime. Every 3 minutes, a new case is reported, and every 41 minutes, a life is lost. These are not just numbers. They're fathers, brothers, husbands, and friends. Prostate cancer is the second leading cause of cancer death in men. It's a silent enemy because it often shows no symptoms until it's advanced. It's a war we're fighting, and we're losing too many men. But there's hope. Early detection is key. It's our secret weapon in this battle against the silent enemy. There are red flags, subtle yet significant, that can help us spot the enemy before it takes hold. These are the signs that prostate cancer may be brewing, and if we heed them, they can save lives. They are the whispers of a body in distress, and we must learn to listen. The importance of understanding these red flags cannot be overstated. They are the difference between catching the enemy off guard or being caught off guard ourselves. They're the difference between a quick victory or a long drawn-out battle. They're the difference between life and death. Ignorance is not bliss in this fight. It's our greatest liability. But knowledge, awareness, and vigilance are our strongest allies. Let's arm ourselves with the right information. Let's be proactive about our health. Now that we know the gravity of the situation, let's dive into the 10 red flags of prostate cancer that every man should be aware of. Starting at number 10, we have urinary changes. This symptom may seem harmless, but it can be a significant red flag. Now, we're not talking about the occasional need to go after enjoying a large cup of tea. No, we're referring to persistent changes that could indicate a problem. Imagine this: you're finding yourself making frequent trips to the loo, even when you've barely sipped any water. Or perhaps you're having difficulty starting or stopping urination, like a stubborn garden hose. Maybe you've noticed a weak flow, as if the pressure's just not there. These aren't just signs of aging or the result of that extra pint at the pub. They could be your body's way of waving a red flag, signaling a potential issue with your prostate. It's crucial to remember that these symptoms don't necessarily mean you have prostate cancer, but they certainly warrant a chat with your healthcare provider. Urinary changes are more than just an inconvenience. They could be a sign of something more sinister. Coming in at number 9 is lower body pain. Yes, that persistent discomfort could be more than just old age. It's a common misconception that pain is a natural part of aging. But when it comes to persistent pain in the hips, thighs, or lower back, it's time to take notice. These are not the typical aches from a strenuous workout or a long day on your feet. These are pains that linger, that interfere with your daily activities, that wake you up at night. They can be subtle, slowly intensifying over time, or they can hit you like a bolt out of the blue. The key here is persistence. If these pains are not easing with rest or over-the-counter remedies, it's time to consult with a healthcare professional. Pain should never be ignored, especially when it's persistent and in the lower body. At number 8, we have erectile dysfunction, a sensitive issue indeed, but one that needs addressing. You see, gentlemen, erectile dysfunction, or the difficulty in maintaining an erection, can sometimes be more than just a momentary concern. You might think it's just stress or age playing its tricks, but surprisingly, it could be a sign of something more serious: prostate cancer. Our bodies have a way of sending us signals when something's not quite right, and erectile dysfunction can be one of those distress calls. Prostate cancer could interfere with the nerves responsible for erections, leading to this issue. So if you're experiencing persistent erectile dysfunction, it's crucial not to dismiss it as just another age-related problem. Remember, it's not about bravado or embarrassment. It's about understanding the signals your body is sending you and taking action. It's not just about performance, it's about health and life. Moving on to number 7, we have unexplained weight loss. Have you been shedding pounds unexpectedly? If the scale is dropping and you're not actively trying to lose weight, it's time to take note. This isn't about celebrating a diet success. Sudden and unexplained weight loss can be a sign of prostate cancer. The body might be using up energy to fight off the disease, or a tumor might be altering your metabolism, leading to this weight loss. It's crucial to understand that this is not a symptom to dismiss lightly. While it might be tempting to relish in the surprise weight loss, remember that your health is at stake. Weight loss might seem like a win, but not when it's unexplained and sudden. So if you're experiencing this symptom, consult a healthcare professional immediately. It's not just about maintaining a healthy weight. It's about understanding the signs your body is giving you and taking the necessary steps towards maintaining your health. Next, at number 6, we have loss of appetite. Are you finding that your favorite foods no longer tempt you? Is your hunger seemingly disappearing? This sudden loss of appetite could be a sign of prostate cancer. Remember, our bodies communicate with us in many ways, and a sudden change in your eating habits, especially a loss of appetite, is a signal you should not ignore. It's time to consult a healthcare professional if you're not feeling hungry as usual. Do not dismiss this symptom as just a temporary phase or a result of stress. This might be your body's way of telling you that it's fighting something more serious. Food is our fuel, and a loss of appetite could mean your body is in a battle. So pay attention to your hunger cues and ensure you're feeding your body what it needs. If something feels off, don't hesitate to seek medical help. It's better to catch something early than to regret not acting sooner. At number 5, we have bone pain. Are you experiencing a consistent ache, especially in the hips, spine, or thighs? This persistent bone pain could be a sign of prostate cancer. It's easy to dismiss this as a symptom of aging or overexertion, but it's crucial to consider all possibilities. Just like the other symptoms we've discussed, this is another way your body communicates with you. It's telling you that something is affecting your support system, your bones. If you're experiencing this kind of pain, it's time to consult a healthcare professional. Don't ignore or downplay this symptom. It's not just about managing the pain, it's about understanding its cause. Remember, your bones are your support system, and persistent pain could be a sign they're under attack. So don't hesitate to seek medical help. Remember, it's always better to know and act than to ignore and regret. At number 4, we have swelling in legs or pelvic area. Have you noticed an unusual puffiness or bloating in the lower regions of your body? This could be another sign of prostate cancer. It's easy to dismiss this swelling as a symptom of poor circulation or water retention, but it's essential to pay attention to the signals your body is sending you. This swelling could be the result of the lymphatic system's response to cancerous cells, indicating that something is amiss in your body. We tend to ignore such signs, attributing them to a sedentary lifestyle or inadequate diet. But it's crucial to listen to your body and understand the message it's trying to convey. If you're experiencing this kind of swelling, it's time to consult a healthcare professional. Remember, it's not just about managing the symptom, it's about understanding its root cause. So, don't hesitate to seek medical help. Swelling is your body's way of saying something's not right. As always, it's better to know and act than to ignore and regret. Moving on to number 3, we have nausea or vomiting. It might surprise you, but persistent nausea or vomiting could be a sign of prostate cancer. Yes, you heard it right. While these symptoms are commonly associated with a stomach bug or food poisoning, in some cases, they could indicate a more severe issue. So, if you find yourself frequently feeling sick or throwing up without an apparent reason, it's time to consult a healthcare professional. It's easy to dismiss these symptoms as a temporary issue, but persistent discomfort should not be taken lightly. Remember, your stomach is trying to tell you something. Listen to it. It's not just about getting through the day, it's about understanding what your body needs. So don't hesitate to seek medical help. Your health is your wealth. And as always, it's better to know and act than to ignore and regret. Next up, at number 2, we have persistent fatigue. Now, this might seem like a common issue that many of us face due to our busy lives, but constant fatigue, even after ample rest, could be a sign of prostate cancer. Yes, you heard it right. If you're constantly feeling tired and drained, it's time to consult a healthcare professional. This symptom should not be dismissed as a mere sign of stress or overworking yourself. It's important to understand that fatigue is more than just being tired. It's your body asking for help, signaling that something is amiss. So don't brush it off. Listen to your body and give it the attention it needs. Remember, your health is your wealth, and nothing, absolutely nothing, should stand in the way of it. As always, it's better to know and act than to ignore and regret. And finally, at number 1, the most critical red flag that should never be ignored: blood in urine or semen. This alarming symptom is not as common as the others we've discussed, but it's one that should never be taken lightly. It's a glaring signal that something is amiss, and it's time to consult a healthcare professional immediately. Now, why is this symptom so significant? Well, the presence of blood in your urine or semen could indicate that cancerous cells are influencing the urinary and reproductive systems. It's a stark reminder that your body is trying to tell you something. And let's face it, it's hard to ignore a message written in red, but don't let fear silence you. This symptom, while alarming, isn't a death sentence. It's a call to action, a prompt to prioritize your health and seek medical help. Remember, this is not a symptom to brush off. It's a critical warning sign that demands immediate attention. So there you have it, the 10 red flags of prostate cancer that every man should be aware of. Let's do a quick recap, shall we? We began with urinary changes, a common early sign that something might be amiss. Then we moved on to the discomfort and pain in the lower body, which can often be dismissed as just part of aging. We talked about erectile dysfunction, a symptom that can affect men's confidence and is often overlooked as a potential sign of prostate cancer. And lastly, we discussed the presence of blood in urine or semen, a clear sign that immediate medical attention is necessary. Now, these symptoms alone don't confirm the presence of prostate cancer. They could be signs of other health issues too, but it's crucial that we don't ignore them. Listen to what your body is telling you and take action. Regular checkups are essential, not just for prostate health, but for overall well-being. Don't wait for symptoms to appear. Be proactive about your health, and let's not keep this vital information to ourselves. Share this video with your friends, your family, your colleagues. You never know whose life you might be saving. If you or someone you know are experiencing any of these symptoms, don't hesitate to consult a healthcare professional. It's better to be safe than sorry. Remember, the earlier prostate cancer is detected, the better the chances for successful treatment. But let's not end on a somber note, shall we? Let's keep the conversation going. Let's continue to educate ourselves and others about prostate cancer and its warning signs. And while we're at it, why not like and subscribe to our channel for more valuable content? We put a lot of time and effort into creating these videos for you, and your support means the world to us. Keep yourself and your loved ones safe. And remember, early detection can save lives. Like and subscribe for more valuable content. We appreciate your time and effort to watch our videos.